Good afternoon. I'm Dr. Pavan Chebbi from Apollo Spectra Hospital here in Bangalore. I'm here to talk about common issues and injuries faced after return to sport and fitness activities after this COVID-19 pandemic. The reason why I chose this is because I've been seeing an increased number of people who are going back to sports, maybe recreational sports, maybe professional sports, be it gym, yoga, any sort of activities which they like to do since everything is opened up now. And I find them coming to me with a lot of injuries. It could be simple sprain, it could be a strain, it could be a cramp or something. It can go as much as a ligament tear, it can go as much as a fracture. Stress fractures are also quite common nowadays, which I'm facing. So now what has happened is, now that things have opened up after the COVID-19 pandemic, it's back to work, back to sports, back to play, and people travel, and while they are in the travel, be it at the beach, be it at a hillside, they like to enjoy themselves with some sort of sporting activities. And here, because of the sudden enthusiasm, a lot of people end up having injuries. Now, these injuries, as I already said, can be as simple as a sprain, can go to a length where it can be a ligament tear, it can be a fracture, it can be a little more dangerous than that. Now, all this can be avoidable, and it doesn't mean that you have to stop playing or you have to be too cautious or anything like that. All this can be avoidable. Only thing is, a few things has to take care. Few things has to be in mind when you are getting back to sport or any other fitness activities. First of all, ample amount of warm-up is necessary. Usually what happens in the spur of the moment and in the excitement, we go out to play sports and end up with these injuries without doing any proper warm-up. So warming up helps to increase the temperature of the body. The core temperature increases, for which the muscles relax. The bloodstream keeps going, it keeps pumping, especially to the hands and legs, so that the person can perform better. Also, adequate amount of stretching. Now, stretching again is very underestimated. A lot of people don't really think that they need some stretch. They say that I have stretched enough, or they probably do a little bit of moving around here and there, and that's it. Stretching is very important because it can ensure, an adequate amount of stretching can ensure that there is a rhythmic movement of the muscles while performing any sports, be it in the gym or be it any kind of pivoting sports like badminton or football or cricket. Here what happens is, adequate amount of stretching will help each and every part of each and every muscle group to perform. It can help it to utilize it as to the maximum, so that you can perform well in the sport. Now also, it is important to have some cool down stretches. That is, after the sports, you have to have some sort of a cool down stretches. This is important because I've seen a lot of people coming with cramps. They do well, they perform well, they have a nice time, and end of the day they start getting cramps, and these don't go away at all. So they keep getting night cramps in the calf muscles, in the back, in the glutes. They have sleepless nights, etc., etc. So cool down stretches helps to avoid these cramps. Now also, it has an advantage of lowering the lactic acid in the in the muscles. So actual cause for these cramps is increased lactic acidosis. So enough amount of hydration is also important along with the cool down stretches. It could be simple water, it could be some sort of an electrolyte drink. Avoid energy drinks. They do have electrolytes, but then it's better if you avoid. They are high on sugar. But then if you can have some sort of an electrolyte balanced drink, or you can have some sort of a proper hydration, which can help you avoid these cramps as much as possible. Now, I've also seen professional sportsmen who have developed new problems. They are good with what they do. They do their cool down stretches well. They do their warm ups and everything properly. But then they develop some problems. They have been developing some problems. So nutrition is adequately important, because a lot of times, because of this sedentary lifestyle which we have had in the past couple of years, we end up having nutritional deficiency. Important to say is these connective tissue vitamins like vitamin D and vitamin B12, when these reduce, the cell regeneration is reduced. So injury caused by a stretch of a muscle, after a post-workout, regeneration is very much delayed, which leads to pains, aches. It can lead to tiredness. It can lead to fatigue, early fatigue while doing exercise and workouts. So nutrition is adequate. So I would recommend that if at all you face these difficulties, you can get a blood test done for essential vitamins, and just the routine blood test as well. So what happens is, making sure that you check your vitamins and the levels of the vitamins, if you have any deficiencies or something like that, can ensure that you can avoid these injuries and chronic pain. And also, because of this, without knowing what is the problem, which can be as simple as correction of a vitamin deficiency, people lose interest in sports. They say that I can't perform anymore, I can't really work anymore because of these constant pains, and not able to identify what the problem is. Sometimes, despite all the precautions, despite adequate nutrition, hydration, there can be instances where a person can get injured. In that case, it is important to get yourself checked with a sports medicine doctor as early as possible, so that if it's a minor thing, we can avoid it. For example, if a person who's developed an injury to the knee joint while doing a sport, maybe say badminton, waits for some time, rests and continues to play, and again twists the same knee, it might lead to more dangerous problems. So I'm talking about if a person maybe had a ACL sprain, but then he or she ignores it, and then goes on after rest to play again, which might lead to much more dangerous problems, which can lead to ACL tears, meniscus tears, and other collateral ligament tears, cartilage injuries, etc., etc. So whenever such sprain happen, it is important to show it to an orthopedician who's an expert in a sports injury, so that you come to know what exactly it is. If it's a small sprain, we have various modes of treatment for that, not necessarily surgical, in which you can rest, you can recuperate, you can do exercises to strengthen certain group of muscles so that the performance is not hampered in any way. So these are the few things which as much as possible you have to be a little careful about, especially after injuries. There is also what I have seen is incidence of stress fractures. So stress fractures are usually common among people who are who have a military background or a police background, who have to go for everyday trainings on a routine basis, jogging and jumping and running and etc., etc. But this I can see in general population as well. So this is when we took an aggregate of all these people, we found that deficiency of vitamin D was the most common cause or common thing which all of these patients had, leading to stress fractures in the knee and the foot. So again, it is important to have a check on whether a person has got nutritional deficiencies or so, because stress fractures can be frustrating. They take a long time to heal. You have to be immobilized for a long time. You have to make sure that there is adequate amount of nutrition has been given. Enough amount of exercise is also even though you are on immobilization, there can be plasters and sprints which can be removable, so that you can continue to do your exercises which are non-weight bearing, etc. So now what I have seen is people who actually have ligament tears, complete ACL tears, or Bankhart's tear, or ligament sprains of the ankle in which it's completely torn and all that. So here there is a fear for getting a surgery done. Be it professional, or be it semi-professional, or be it people who are just recreational sportsmen, they'd rather stop playing but get a surgery done. But I can assure you that most of the treatment we provide over here at Apollo Spectra Hospital, especially sports-related injuries, there is a guarantee which I give to return to sport. So return to sport is one of the main indications for getting that ligament reconstruction done. So right now there are so many cell regenerative therapies. There are the techniques of surgeries, minimally invasive surgeries, and lot of PRP therapy, stem cell therapy, which can ensure that a person can get back to sport as the person was before, and completely normally with full performance. So without any fear, if at all someone has any sort of sports related injury, be it any part of the body, it can be fixed, ensuring that a person can return to sport with full amount of performance. So this is what I wanted to talk about: common musculoskeletal injuries, which I have seen in my OPD, and a lot of other colleagues of mine, orthopedicians, have seen post-pandemic especially, and which are very easily avoidable, which is never been so much of a problem that it can make a person to stop playing, or make a person to ignore sports. So as much as possible, be active, be healthy, and go back to sports, fitness, gym, dance, yoga, aerobics, Pilates, anything and everything for that matter, without any fear. Thank you.
Doctor, patient want to ask some question. So, thank you, doctor.
Thanks.
I get cramps every night in the leg, especially clamp muscle since I started playing badminton. I do proper stretching and warm up, but still this cramp happen because of disturbed sleep, doctor.
Acha, okay. Yes. Now, these cramps, as I already mentioned, is because of increased lactic acid in the muscle. So overperformance, or maybe just a regular day at a playground, can increase these cramps because of dehydration, because of vitamin deficiencies, because of no proper stretching post sports. So these can cause these cramps, and these can be very disturbing, as I already told. Night cramps especially can lead to sleepless nights. So it is important I would say that better get a basic vitamin test done, basic blood test done, to check out if there is any deficiency, and along with it, as usual, start working on your hydration, maybe electrolyte induced hydration with proper cool down stretches, etc.
Doctor, I have old is ACL tear, but I am able to manage since 2 years with no pain. But now I have started developing fullness and pain, but I am doing regular physiotherapy and wearing a cap. My question is, do I need to get surgery now after 2 years, and it will be successful?
Okay. Yes. So yeah, I believe that this gentleman or lady has gentleman, yeah, has got a old ACL tear, but they are able to perform, is it?
Yes, sir.
Yeah, okay. But the pain is increased. Yeah. So this, yeah, I this is quite common because usually ACL tears are not that painful. Suppose a person tears his ACL on the ground right now. For a few hours or maybe a few days, he or she will have the pain. Later on, the pain disappears. But one thing is left out is he or she will have instability. The knee keeps buckling, the knee keeps twisting. Some people, they tend to adjust their movement and they try to continue to play, etc., etc. A lot of people are there who do that, who have good muscle mass, they do that. But something more sinister will be happening in the knee joint while this happens. So probably it's been 2 years that you had this ACL tear, and probably you might have come back to sports now. This is what I understand. Now, probably there might have been some sort of a meniscal injury also, some sort of a cartilage degeneration as well. So probably you are developing osteoarthritis. However, you can get a successful ACL reconstruction done even now. And yes, it is successful, because what happens is when we go inside the knee with a camera, we don't just reconstruct the ACL. We repair anything else around it as well, which is injured. Maybe if it's a meniscal tear, we repair it. If there is a cartilage injury, we repair it also. We have ACIs, we have PRP injections, we have mosaic plasty where we take cartilage from the non-useful area and put it back in that particular area. And meniscal repairs also are highly successful nowadays with the type of equipment which we have. So yes, of course, you can have a successful ACL reconstruction and get back to complete sports with full performance after the surgery.
Doctor, there is a constant ankle sprain I get, but I managed to play despite this twist. We had met earlier also, Doctor, regarding this issue.
Yeah, yes, ankle sprain.
Yeah, Doctor.
Yeah. I'll have to check the chats to see if you've met earlier. I'm sure I'll remember you. So ankle sprains, yes, so this is also something common which I get. These ankle sprains, usually it's a very common injury, ankle sprain. So once a person sprains his or her ankle, if proper treatment is given initially, then it heals very well, it heals beautifully. But sometimes if there is a major tear, or if there is some sort of, if some people ignore the sprain, then it becomes a chronic sprain, in which when you perform in any sports, it keeps twisting, the ankle becomes unstable. And some people have instability even while walking on uneven surfaces, on slippery surfaces. So they have to guard their ankle as much as possible, just like the ACL, And these can be painful, actually. Ankle sprain can be painful, unlike the ACL. So, reconstruction of the ankle ligaments, especially the lateral ankle ligaments, is very easy, and it can be done on a daycare basis with complete return to sports just in 3 months, and pivoting sports up to about 5 to 6 months. A person can go back to badminton and football, etc. Regular gym and running, etc. in 3 months the person can return to it. So I don't know, I'll have to check the chat. If at all you've got an MRI, then we can plan for a ligament reconstruction of the ankle as well. Thank you. Any other questions?
No, Doctor, that's all.